Us, JLUSA's Facebook Live discussion series. I am DeAnna Hoskins, CEO and President of Just Leadership USA. Just Leadership amplifies the power of directly impacted people by investing, educating, and empowering and elevating their voices so they have the tools and resources necessary to self-organize and advocate for themselves, their families, and their communities. The arrival of COVID-19 pandemic exposed the systemic inequalities and racism in the country's incarceration and detention policies, specifically the lack of emergency preparedness within the U.S. criminal legal system. In response, we launched the Just Us campaign, calling on legislators to enact proactive solutions to protect human beings who are behind bars during COVID-19, a crisis such as a climate change-induced weather condition, and inhumane living conditions. To discuss the importance of the U.S. criminal legal system adopting management protocols in the context of healthcare, we are joined by Dr. Marcella Nuñez-Smith. Dr. Nuñez-Smith is Associate Dean of Health Equity Research, CNH Lone Professor of Medicine, Public Health and Management, and Director of Equity Research and Innovation Center at Yale. Her research focuses on health and healthcare equity for marginalized populations with an emphasis on the social and structural determinants of health, the influence of healthcare systems on health disparities, and the advancement of community academic partner scholarships. Dr. Nuñez-Smith currently serves as Senior Advisor to the White House COVID-19 Response Team and Chair of the Presidential COVID-19 Health Equity Task Force. Welcome, Dr. Nuñez-Smith.
Oh, thank you so much. Thank you for that kind introduction. I'm so happy to see you and to be here in conversation with you today. Thank you for this invitation.
No, thank you for joining us. It's been a while, and I know you guys have been busy since the creation of the Equity Task Force. So I just kind of want to talk about this from, the health equity and your expertise and anything that has bubbled up in your current role as working with the health equity can be shared with our listening audience. That would be great.
Yeah.
I want to propose this one question that I think sets the background. And so according to the CDC, Black, Latina, and Native Americans are affected with coronavirus and hospitalized with COVID-19 at higher rates than white Americans. And they have died of the illness nearly at 3 times the rate. And while we have a vaccine, there's a realization that another strand, a lot of people in marginalized communities have not been vaccinated. Can you tell us why were marginalized communities so vulnerable to COVID-19?
Yeah, and it's just important to have that moment of pause because I'm grateful for you to bring kind of the reality of those statistics. But, you and I know that when we talk about, 3 times, we're talking about people's family members, right? We're talking about the loved ones we have lost to this pandemic. And there is a grief gap between communities, right? Because when we talk about Black, Brown, Indigenous, you so rightly said, communities that have been marginalized, minoritized, medically underserved, we're dealing with a lot because it is both that increased rates of cases and hospitalizations, but the loss, the grief, the suffering, and the economic reality, right, for people. I've been fortunate to partner last year and again this year with many colleagues to do some national survey work and polling work. And even from early on last year, we saw that in, places and homes where people identified as Black or African American, already early on, the economic toll was real, right? We were seeing 30% drop in wages, income, right? We were seeing people saying, I'm losing my job, I'm losing hours. And so all of this reality is what we're living with today. And so you're right, because the question is, how do we get here? Because we need to answer that so we can make sure we don't end up here again. And we know, right, and that's the work that the president has charged us with on the task force to be thinking about those recommendations. On the COVID-19 response team, he has also charged us there to be thinking in everything that we do, look, center equity in this. So when we're talking about vaccine, I've got to make sure vaccines are accessible to everybody. We can talk more about what those initiatives have looked like, but I know I'm grateful because at the end of the day, it's always person to person in that vaccination space is those vaccination testimonials, but we got to make sure everybody has access, right? Mm-hmm. Access to the vaccines. So, how do we get here? And it is a multi-pronged, answer. The reality is it was predictable. And that's what is so deeply problematic because you could predict exactly who would get affected because it reflects, right, the structural disinvestment in particular communities, not yesterday, right, not 10 years ago, but over generations. And that's what we're dealing with. So whether that means that the legacy of that is that people are living in environments where there is high exposure to toxins, right? And those very toxins put people at risk for more severe COVID-19, whether people have had limited access to quality healthcare, so that important conditions have not been diagnosed or properly treated, whether it's the fact that Black and brown people and just overrepresented in terms of the workforce that we deemed essential at the time. And I own this too. I think we in the public health community, failed at the beginning to properly message. We say things like stay home, and not understanding that that is not an option for so many people, right? And so not giving that message to say, if you're taking public transportation, this is how to be safe. If you're interacting with the public all day long, this is how to keep safe. We didn't have for everyone the PPE at the beginning. And so all of these structural realities we don't talk enough about, the structural racism that's there, that's driving kind of people's skepticism, which is well earned, a distrust of a lot of the same institutions that are trying to message, that have proved themselves untrustworthy over time. All of that comes together. We talk about people living in multi-generational homes, in crowded neighborhoods. Of course, we're thinking about everyone who is like justice involved, and look, Lord, the structural barriers that exist there, right? And so it's the predictability is what's so troubling. And so it's disrupting the predictability that is our work that the president has charged us with now, and of course, moving forward in recovery.
You said some things that I think were very important that a lot of people didn't pay attention to. And one, I want to acknowledge early on at the beginning of this, you're hearing our voices from Just Leadership talking about individuals inside correctional facilities, because we were all overwhelmed. This was a world, a U.S. issue, and we knew that population may be getting forgotten, and we just needed to keep them at the forefront. But you said something important that most people didn't pay attention to at the beginning of this pandemic. The hardest hit were the marginalized communities. Yes. They were in those industries that got shut down immediately, whether it was a service industry or restaurant, events where you coordinate with. Basically, if you were not in a hospital setting or other settings, you were pretty much shut down. And those were especially for us with criminal backgrounds, those were the industries, construction and all, where people are more lenient to employ us who have a criminal background. So I want to thank you for bringing that to the forefront. Another thing, when we start talking about people in correctional facilities, we know that people in prisons and jails are disproportionately likely to have chronic health problems, including diabetes, high blood pressure, HIV, as well as substance and mental health issues. Hepatitis C is 9 to 10 times more prevalent in correctional facilities than in our communities. Over 95% of incarcerated individuals will eventually return to their communities, and their health problems and their needs come with them. Yes. What are some of the public health implications of barriers to access to safety in the form of healthcare and preventive care behind? Because I don't think people tie healthcare when they talk about the word safety.
Safety. No, I think absolutely, right? This is fundamental. And that is our question. Just grateful for you lifting it up. Let me take a moment right now to, because I didn't say it at the top, because I do need to thank you personally and Just Leadership, because, the work that you're doing, it's the conversations like today, but it's the action, right? And I know I'm grateful. My colleagues are grateful because you do take the time to meet with us, right? To inform us, to hold us, keep us accountable, right? We need that. And let's keep it coming. And I think really importantly, that we have to use this moment. This is an opportunity, right? We're talking about COVID-19. We're focused on that. We're still in a pandemic. But what you highlight is critical, right? That COVID is happening within a context where we already know that there's certain groups that are just set up, right, to be on the receiving end of the COVID bad news, right? And that is reality. And we need to disrupt that. And that this is all of us, right? This is our shared interest, our shared work, to do. And so when you talk about kind of that porous nation, the porous nature, right? People are going to be obviously in community. And we, of course, are here to welcome folks back and understand that the needs will be health needs, certainly, physical health, mental health, and that is our obligation to think about that, to address all those things that we refer to as the structural social determinants. People will need stable housing. This is all part of health, right? So I really appreciate how you link it, like healthcare to safety. Yes, absolutely. We saw that folks who were, behind bars early on, I was hearing about kind of people not having access to masks, right? Really motivating. Of course, people are going to be upset and up in arms, right? When can't have the most basic protections. So, all the ways that you're linking healthcare to safety. But, I think we often don't link stable housing to healthcare and safety, right? Making sure people have access to nutritious food to healthcare and safety, right? That there's economic educational opportunity for folks to healthcare and safety. And that is what we need to talk about, is taking that holistic approach to health, to healthcare, to well-being, physical health, mental health, behavioral health, making sure, we have a problem in this country. We don't have parity for mental health service provision, for help with substance use disorder, right? So hard to access when we think about treatments and therapy. So all of that is the urgent work. And a point I want to make, because even when you talk about hepatitis C being 9 to 10 times, data are hard to get, particularly in this space. And early on, we did not know what was happening in prisons and jails around the country, detention centers, because those data were hard to get. And so we have to also say we're going to lift up the individual stories of people, but we're going to call and push for the data that we need to guide and target resources and interventions exactly as you speak about.
That's very important, because a lot of times people don't realize how hard it is to get data from correctional facilities, because when you're talking about a congregate living area, there are individuals who are going to be held accountable, whether it's the commissioner over the whole state Department of Corrections or the warden or superintendent of that facility. And we saw that during COVID. In the beginning, we were getting numbers, and then when it hit this height, they shut down on giving us numbers. Yes. So we know the numbers I'm going to quote to you here, we know that's just an assumption.
That's right. That's
right. Just an assumption that over 500,000 staff and incarcerated people were infected, that only 2,700 individuals who were incarcerated have died from COVID-19. And that's just the numbers we got. So we don't even know how many numbers. And I think here in Ohio, one of the things we found out was that when people were getting really ill, the correctional facilities were sending them out to the hospital. Yeah. And if they passed away at the hospital, they were not counted as a facility casualty. But in reality, what we're talking about this conversation, that's data we need to know, because they became ill inside.
Yes.
So this next question, and I also want to uplift the fact of how I think we failed the staff who work in those correctional facilities as well. We have families who are in communities as well, who actually go home every 12 hours back to those communities.
That's right.
We really did not pull this safety thing from a healthcare perspective and make it a priority for that population and the staff.
Agreed.
I want to ask you, what can the medical or correctional medical community, because a lot of times that's different, right? Medical community operates different than the correctional medical community. What could be done that we can avoid devastating impacts that what we saw with COVID-19 on carceral settings?
Yes, absolutely. And this is the work, and I think this is really key to say that from the top, we talk about leadership at the federal level, the president, the vice president. This is a call to action that we're going to be thinking about equity at every step of the way. And we take a broad lens when we talk about equity. And we know the intersections here when we say, everyone who's incarcerated, history of incarceration, that we know that's racialized in our country. So we understand the intersections and the intersectionality here, but to call up specifically and say, this is a special population that we have to be intentional about, because as in all things with equity, it's not going to happen by default. These are groups that, the need for ongoing sort of a voice, power representation at the table is key and critical, because we have to have a policy conversation. We look around and we see even a patchwork. You said something that's so key, right? You talked about congregate settings. Now, why has this been such a controversial issue in the country? To say we understand the risk is high, for COVID-19, for any, infectious disease in congregate settings, yet we pull apart and we say, a long-term care facility or a nursing home is a different kind of congregate setting, right? From a prison or a jail. And so, even at that most fundamental level, when we say the highest risk is congregate settings, but then in many places we see a bifurcation in terms of policy. One policy, around protecting residents and staff at nursing homes and long-term care facilities. And not to take away from that, that's critical, right? But then for there to have to be controversy to say, well, we have other congregate settings, right? Be they group homes or prisons or jails, right? And so the virus sees them both the same. And so, we have to continue to advance on that policy setting. We have to, this has been a challenge in so much of the work, how highly politicized everything has become. When we're just talking about basic public health. And, I think that's just an area we have to be advancing on, is to say, we understand the science, we need to follow the science. We need to say a congregate setting is a congregate setting, and then do accordingly in terms of public health mitigation, intervention, and resource allocation.
I appreciate that, because you're right. It's always as if individuals who are in correctional settings or jail is somehow not dehumanized, almost, when you split those policies, right? Yes. When COVID-19 came out and we had these groups who were prioritized, and 1A was congregate living, nursing homes, long-term care, but prisons and jails were pulled out and put at the end of that baffled me. But I also understand you spoke on it.
Yes.
The continued legacy of dehumanizing or not prioritizing a certain class of people, a certain race of people, are falling into that. But also in this country, we have even kind of separated the needs for people returning to communities from prisons and jails around what we were calling reentry. And one of my biggest arguments has been, we've acted as if it's a siloed issue, when in reality, you spoke on it. Having access to housing is a safety issue. Having access to healthcare is a safety issue. And we could no longer talk about this, which is why Just Leadership launched this Just Us campaign, because we realized the world was dealing with this pandemic. But inside correctional facilities, we deal with disasters all the time that nobody pays attention to. And when we launched it, we were launching it on the historical aspect of Hurricane Katrina, Hurricane Ike, and the impact on correctional facilities. And my biggest saying was, Louisiana had an evacuation plan for cats and dogs. The Humane Society, correctional facilities, put human beings on a bridge, praying that the water didn't come up. But then we got a recent with the Texas ice storms. So now I'm in climate conversations of, you can't talk about the harm of climate change without talking about this population, because what we saw in Texas less than a year ago was, when the ice storms hit, the jail lost heat just like everybody in their homes did. Staff couldn't get to the facility to fix the meals, and the kitchen wasn't working. So we as the public were putting money, and we still allowed the profiteering, because they had to order commissary. And everybody don't have family to send money to their books to order commissary. And nobody was paying attention to the responsibility of the state to take care of that individual. When a judge sentences you, he's sentencing you to the care and custody of the state. If the state facility cannot fix the nutritional needs for you, the state should have to find alternate options. But they didn't. They left it upon them. And they allow the private corporation who sells commissary to benefit during that emergency, to sell the prepared food So that's a whole, that's a whole nother
I mean,
argument.
but that's a real conversation as we talk about. And, and you're talking, I'm so grateful because, and I've certainly even been learning more about this myself. You're talking about commissary. That's one important thing. Here in Connecticut, we've had a big conversation about communication, phones, right? And being able to communicate with loved ones. And as we talk about, right, what we used to call reentry, everything, but people need to have connection to community, right? Mm-hmm. Connection to family, that security, that safety. And this is such an important conversation because, what do we value? What do we value as a people? And this is a crucial, I think, self-query and self-interrogation, because every life, right, has worth, has value. We say everybody, as I talk about things like vaccination, I say everyone is worth the time to talk to, right, about vaccination, to answer a question. Everybody is worth this. Yet sometimes our policies say different, right? Mm-hmm. And so this is a moment where I think, and I'm rightly asked often, there is such a hyper focus, and perhaps understandably so, but this hyper focus on COVID-19, really. But for so many people, their question is, where have you all been, right? I mean, where have you been? All of these challenges didn't start with COVID, right? They're not going to end with COVID. And I think that's the right thing to say, look, if we're going to have a conversation now about equity in COVID-19, it's obligatory that we have a conversation about equity coming out of COVID-19. Right. What's going to be different? Where are those opportunities? And you're right, a lot of that work is going to happen in these conversations in state capitals, right, and other places. But it behooves all of us. Everybody's joining us in conversation today. It's our responsibility to be informed, right, to get that seat at the table, and to be really advocates on the policy front. Because you got to name it and you got to fix it, right? But you can't. And this is what we always come back to. It's important to have the data. It's important to have the lived experience centered on that, and the importance of narrative and story. When you talk about, access to food and how that becomes privileged in time of crisis, right? I mean, that is the kind of power that many policy makers, need to hear, like that sort of pragmatic, what does this mean? This is not some hypothetical harm that people are exposed to. This is real. So, I'm firmly here to say the federal administration understands this is here to be held accountable in this space, and to encourage everybody to continue, right, to push this conversation in local settings, in state capitals, local policymakers and leaders, because there's a lot more work that we can do.
And that is actually, thank you for that, because that is exactly how we designed the Just Us campaign, where we're having federal conversations,
That's
but
right.
we've designed it that our leaders within the states, to empower them to have those conversations at their state level as well, right? How do you have your local state Department of Corrections and your governor adopt a preparedness plan of how are we preparing to preserve the lives of people in these facilities in the event of a pandemic? I always utilize schools and office buildings, and I always say, I don't know if everybody remember, but we constantly did practice fire drills.
Of course.
We constantly did practice fire drills when I worked for county administration and the federal government. Exactly. And that was to be prepared of what the plan was in case of an emergency. You can't wait to an emergency to come up with the plan. You have to have a plan that is in place that says, if this type of emergency comes, what are the levers that we pull that preserves the lives of the people in this congregate living area, right?
That's exactly right. And I think, and congratulations on that and the campaign, right? Because just as is what we need. And I think for so many, and you started off by saying, because this is the right posture, what lessons can we be learning now?
Mm-hmm.
And so this is one that's key, the preparedness. And so you say, listen, in so many arenas, people were not prepared, did not anticipate, but now we know. So what is the excuse, right, for not committing to preparedness planning and execution when it's time? So just grateful for that work again, really giving people the tools to be able to advance those conversations, that discourse in community, in local settings, on the ground. And that's what it's going to take.
Yep. And it's really about policies of where the rubber hits the road,
That's
right? Because a lot of times we have policy and it really doesn't take impact immediately. But what are the things that actually are going to preserve and change the trajectory of people's lives? So I have one more question because I know you're busy and I want you to close us out with this. We know the U.S. medical system has abused marginalized people in the forms of neglect to experimentation, for example, Tuskegee. And I think that's the historical aspect everyone was saying when the vaccines came. We remember the Tuskegee experiment and think about how many years that was. So how that has went, that story, that history has went over in generations. The dynamic is especially prevalent within incarcerated communities. Directly impacted people give prisons low grades when it comes to medical care anyway, outside of a pandemic or anything. In 2018, a survey, 69% of respondents gave it a poor rating and only 3% chose good. How can we build trust in the medical establishment among marginalized communities? And secondly, what advice would you offer to folks who are distrustful of a healthcare system that has historically contributed to oppression and harm of their communities in and outside the criminal justice system?
Yes, thank you for that. And that, that is the question. And I would even take us a step further in the frame, right? And say, it's not all historic, right? That there's contemporary realities there too. And so for some people, you need only to think of the last time you tried to get healthcare for yourself or your family member and felt disrespected, and felt like you received subpar care. So the reality is there's both the historic and the contemporary. When we talk about things like the U.S. Public Health Service, study of untreated syphilis in the Negro male at Tuskegee, that people know. I mean, this is passed on. Who of us has not had this conversation with our family members, right? To understand this is part of our identity formation, right? These are the institutions and what they have done. I think really importantly, so even as one example, the families of the men who were enrolled in that study, they've come out and they've said they've gotten vaccinated. They're encouraging people to get vaccinated because we have to do two things, right? We have to first acknowledge this is real. People talk about mistrust. It's not mistrust, right? This has been earned distrust. These institutions have not proven themselves trustworthy. So that the onus is on institutions, not on individuals, right? The onus is on institutions to demonstrate trustworthiness. So the question is about doing that, the strategies to demonstrate trustworthiness. So one is acknowledging, yes, this is real, historical and contemporary. Mm-hmm. But it's so important for communities that have been marginalized and minoritized. We can't stop there. Right? This is a disservice to ourselves when we stop and we say, we know about Tuskegee and other things. I take a pass. And I'm like, we cannot deny ourselves access to scientific discovery. That's our birthright, right? To be able to take advantage. And so whether we're talking about something like a vaccine or we're talking about access to high quality healthcare, which you alluded to in those survey results, right? If we say, listen, people need to have the right to get the care that is high quality, to access healthcare. And this is a big challenge for us in our country on, writ large. But coming out of the pandemic, we look in the mirror and we see that something has to be done, right? In terms of our sick care system. How do we transform so that we are in fact promoting health, wellness, and well-being is the right thing to do, but also we can't afford, let's be real. We can't afford in terms of lost potential of humans. And that is underscoring so much of our conversation today because talent is everywhere. I don't know who next is going to have the cure for cancer, right? I want to make sure that person is getting access to good healthcare today. So that is really important, right? But we also have to think about the financial costs and resources when we try to address problems that could have been prevented in the first place. And so, we're having a focused conversation today about people who are incarcerated, have a history of incarceration. And I think this is a canary in the coal mine, community and group, right? Yeah. And really history will judge us by how do we respond to these signals we see here where there is such urgent need. And so I'm, grateful to be in this posture of learning and listening. Our doors are open in terms of the federal administration, and really just continue to encourage everyone on that policy front. You so rightly said, because the solutions are going to be there. And we know we're going to call for, require, right, the data to guide the policy, fundamental. And we're not going to let up, and we're not going to frame this really as an issue of morality. This is not a political issue either, right? This is what we need to do as an entire whole society to recover from the pandemic in an equitable way.
I appreciate all that you said, and especially about the importance of hearing the stories and the importance of our voices and our families' voices. You know, there's the judge in my case just passed away, and he always had this this quote that he would tell other judges and people: never be afraid to do the right thing.
That's right.
Just never be afraid to do the right thing. So I want to thank you for joining us today. I do want to close out with the audience to understand that failure to prevent avoidable deaths during this inevitable moments of crisis weakens our commitment to our common value of human dignity, fairness, and equal justice. By neglecting the safety of millions of people currently trapped in correctional facilities, our society, elected officials, and those currently in power showed once again how Black and Brown people are treated in the United States. This type of systemic racism is the result of generational legacy of slavery, such as Dr. Nuñez-Smith said, and changing past policies is critical to decarcerating the United States. They were sentenced to serve time, not sentenced to death. This is a nationwide call to action for policymakers to decarcerate the U.S. by immediately adopting federal and state-based policies, recommendations that save the lives of incarcerated people during any type of major crisis. The Just Us campaign's policy recommendations address the pipelines of the criminal justice system, from law enforcement to courts to Department of Corrections, to act in sync, to act responsibly, and save human lives in every kind of disasters, from a flood to a cyber attack. We invite all of you to join our campaign at jousa.org/justus, or text JOIN to JLUSA 55872. Again, Dr. Nuñez-Smith, thank you, as always, for hearing our voice, for actually helping us live up to our founding principles that you believe in, that those closest to the problem are closest to the solution, but furthest from resource and power, and that our voices do matter. And a seat at the table. I'll close with turning it over to you. Shirley Chisholm said, if they don't give you a seat at the table, bring in a folding chair.
Bring a folding chair. That's right. I love Shirley Chisholm. Bring a folding chair.
If they don't give you a seat at the table, we'll just build our own.
Build our own. And so thank you. And just thank you so much for everything that you are doing. You are definitely one of my sheroes. And listen, keep the fire on us. Yes. Keep it on us. Thank you for all you're doing. And for everybody who's in conversation, thank you for all you're doing as well.
Thank you.